Welcome to our channel. Today, we're diving deep into a serious cardiovascular condition known as aortic stenosis. This is a condition that affects one of the heart's vital valves, the aortic valve. The aortic valve is responsible for ensuring that blood flows from the heart into the aorta, the body's main artery, which then supplies oxygenated blood to the rest of the body. When this valve narrows, it can lead to significant complications, and understanding aortic stenosis is crucial for both prevention and treatment. Aortic stenosis often develops gradually and can be asymptomatic during its early stages. As the valve narrows, it becomes harder for the heart to pump blood through it. This extra strain can lead to various symptoms as the disease progresses. The classic symptoms to watch for include shortness of breath, especially during exertion, chest pain or tightness, and fainting or feeling dizzy during physical activity. Some patients may also experience fatigue or a general sense of weakness. There are several causes of aortic stenosis. The most common is age-related calcific degeneration, which occurs as calcium deposits build up in the valve over time, eventually limiting its ability to open fully. This is more common in older adults, typically those over the age of 70. Another cause is a congenital valve defect. Some individuals are born with a heart valve that has only 2 leaflets instead of 3, which can predispose them to stenosis sooner in life. Furthermore, rheumatic fever, a complication of untreated strep throat, can damage the aortic valve, leading to stenosis. Diagnosis of aortic stenosis typically begins with a thorough physical examination and a review of the patient's medical history. A healthcare provider may notice a characteristic heart murmur during a routine checkup. To confirm the diagnosis, several imaging tests can be utilized, most commonly an echocardiogram, which uses sound waves to create images of the heart and its valves. Additional tests, such as chest X-rays, electrocardiograms, or cardiac catheterization, may also be performed to assess the severity of the condition and guide treatment choices. When it comes to treating aortic stenosis, the approach often depends on the severity of the condition and the symptoms present. In mild cases, a watchful waiting approach may be taken, with regular monitoring. However, once symptoms develop or if the stenosis is severe, treatment typically involves some form of intervention. The most common procedure is aortic valve replacement, which may be performed through traditional open heart surgery or via a less invasive method called transcatheter aortic valve replacement, or TAVR. This latter technique involves threading a replacement valve through a blood vessel, which can be particularly beneficial for patients who are at high risk for complications from open heart surgery. It's essential to discuss lifestyle changes that may impact heart health, such as adopting a heart-healthy diet, engaging in regular exercise, and managing conditions like high blood pressure, high cholesterol, and diabetes. Regular follow-ups with a healthcare provider are crucial, as they can help monitor the condition and detect any changes that may necessitate intervention. In conclusion, aortic stenosis is a potentially serious condition that warrants attention and action. Knowledge of its causes, symptoms, and treatment options is vital for those affected and for their families. If you or someone you know is experiencing any symptoms associated with this condition, please seek medical advice promptly. Your heart health is paramount. Thank you for joining us today to learn more about aortic stenosis. Don't forget to like, share, and subscribe for more informative content about heart health and other medical topics. Stay healthy.